Welcome back to Insight. I'm here at Indiana Physical Therapy with Mary. We're going to talk about rotator cuff injuries. You are here at the Carroll Road location.
Yes.
This is where you usually are. You see a lot of rotator cuff injuries, don't you?
Unfortunately, rotator cuff injuries and post-surgical repairs, yeah.
And it happens to people who are more seasoned, like myself in life, right?
Unfortunately, yeah, most people over the age of 40 will tend to kind of wear down their rotator cuff, and they have, a tear or some micro tearing in there that kind of gets injured. Sometimes we can treat it conservatively. Sometimes, unfortunately, they need to have surgery to repair it.
Okay, so let's say I have the surgery and then I'm going to need to have physical therapy after the surgery. How soon after the surgery does that start?
Usually we start the next day.
Oh, wow.
After surgery. Yeah, we kind of hit the ground running. You're in a sling for 4 to 6 weeks, depending on the repair, and then usually we start the next day because we don't want that shoulder to get too stiff. So we do some motion through that joint, and then we show you some simple exercises to do at home. Yeah.
So it starts the next day. How long does that, I realize everybody's different, but for a typical, how long does that therapy last?
So usually you're in therapy for about 4 months, unfortunately, because you're not able to move it at all for 4 to 6 weeks, and then all we're working on for the next several weeks is just gentle motion that you're doing yourself, and then we eventually get to strengthening. Yeah.
Here's the $1 million question. Am I ever going to get back to normal, what I may consider normal?
Oh, yes.
Normal at 45 is not the same as when I was 25.
Right, yeah.
Can I get back to full range?
Definitely, yeah. And if it's a large tear and there was a large repair that needed to be done, sometimes you don't get all your motion back, but you're within a couple degrees each way. So you don't ever really notice the motion that you've lost. Yeah.
So that progression from barely, moving to
strengthening,
getting it all the way back takes that amount of time. It's really important to not just come in to see you guys. It's really important to do that work at home too, right?
Yeah, we see our patients about 2 or 3 times a week throughout this process, and then the real work is done at home. Yeah, we give you exercises, we give you equipment to use, and that kind of stuff.
Because I will say that the times in my life when I've had to have physical therapy, I probably wasn't the best patient at home. It's much easier to do when you guys are in here pushing me and telling me
There's some
what
accountability
to do. Yes,
there.
yeah. When I'm at home, I may be, because it's not the most pleasant. I mean, you just had surgery. It's a little painful.
Yep, yeah. And then we do reassessments every couple days, and we send that off to the doctor so he kind of knows how you're progressing or sometimes how you're not progressing. Yes, we keep him updated.
So we talked about after surgery. If it's a preventative, let's say that I'm having pain, and I think it might be, I'm obviously not going to know it's my rotator cuff. I'm just knowing I'm having pain. I come in here to see you guys. I can just come in here, right?
Oh, yes.
And you can tell me, yeah, maybe we can make some inroads. Maybe we can help you out before you have to have surgery or keep you from having surgery.
Definitely.
I don't need to go see my doctor first, right?
No. You can come in and see us. We can do a thorough examination and then choose an avenue we need to go down. Yes, we can treat this conservatively. Let's see for a couple weeks, and then you should be good to go. This might require some interventions from an orthopedist. Let's get you strong. Let's get you stretched out. Then go see him, or immediate referral to orthopedic surgeon.
Because I think all of us would prefer to go the physical therapy route first.
Yes, most people don't want to take 4 months out of their life to rehab a shoulder, so they prefer to avoid it as much as they can.
Well, if you want to try and get that shoulder fixed first, or if you've had the surgery and you need the physical therapy, Indiana Physical Therapy is the place to go. You can come to this fantastic location and visit Mary at the Carroll Road location, or you can visit any of their 16 locations. Just call that central scheduling number, 260-209-2464. Visit them at indianapt.com. I'll be right back.